If you want to deliver healthcare on a holistic level, it really needs to be done in an integrated way.
Another question for you. So if we take all of this, the idea of integrated healthcare, I mean, you are responsible in one of the world's foremost pharmaceutical companies for integrated healthcare. What do you think the role of pharmaceutical companies should be in integrated healthcare?
To get a bit more specific about my role, just to put this in context, so I'm part of the medical affairs organization. Actually, of course, the topic around integrated healthcare solution these days keeps a lot of people busy in our organization because it's complex, right? Starting from the technology part up to how you integrate it then in a standard of care workflow, or how this might be then reflected in guidelines, etc., which we all hope will happen in the future. But I think with my role in medical affairs, what of course is an important aspect is that you can deliver value by adding this. I think what none of the healthcare systems usually would like to see, that you just keep adding innovation. With this also, usually you're adding budgets that then need to be somehow allocated to this innovation. So what we would like to understand early on, especially from a medical perspective, what is really the added value? We talked a bit about patient outcome and improving the overall patient experience, let's put it this way as well. And how can we quantify that on an evidence-based level so that different healthcare stakeholders would accept this, and not just the clinician who's treating the patient, but the payer. Potentially someone has to put budget aside for that, or maybe for some countries you might need to even change policies to allow for that, constant data flow going back and forth. So, and this can only be achieved with robust evidences for very good reasons. And this is why me now being part of the medical affairs organization, where we are very much connected to healthcare providers, understanding standard of care in different countries. No country has obviously the same standards and infrastructure ready these days. So how can we, based on evidence generation, understanding clinical care, help then, or be a partner in what you're just asking for? So and I think I already said it, it's a partnership model that I think will be the key to success, because we already said it's complex. We have many players in the field dealing with healthcare questions or delivering healthcare. And therefore, if you want to deliver healthcare on a holistic level, it really needs to be done in an integrated way. And no player can provide the required breadth and depth and excellence of these offerings in a standalone fashion. So that's why collaboration is a key piece of it.